Well, good morning, everyone. My name is Dr. Kevin Most. I'm doing a Facebook Live from Living Well Cancer Resource Center out here in Geneva, Illinois. And I could tell you one thing, that the staff here misses you probably as much as you miss them. They understand what you're going through. They understand everything that's going on right now. But boy, do they want to get back and help you and support you. So although you miss them quite a bit, I can tell you that the staff and volunteers here miss you as well. When will Living Well be back and up and running? We're hoping to be able to hit phase 4, hopefully within the month or at the end of the month, but we're not sure yet. But again, we're going to go by the opening of Living Well based on the governor's recommendations for Restore Illinois. And we're doing that for your safety as well as the safety of the staff and those around us. So I know it upsets you. I know you're missing this. I know you're missing the socialization with your friends, but please just understand we're doing this for your health and for the health of everyone around. So I appreciate the opportunity to come and talk to you guys because I know you fall into that vulnerable population, whether it's you as someone, a survivor of cancer, someone who is taking chemotherapy, or your family members. And one of the concerns I know that you've had is it safe for me to go to my doctor's office? Is it safe for me to go to the infusion center? Is it safe for me to go and get chemotherapy? I'm going to go over a couple of things that hopefully by the time I'm done in a few minutes, it'll be reassuring for you that we've done everything we can to make it as safe as possible for you to continue to get the great care that you're getting, not only at Northwestern, but at your doctor's office as well. So let's start and talk about that. What are we doing about the offices? We'll talk about the offices and the cancer center, and then I'll tell you briefly about what's going on at the hospital. When we look at the offices, we are concerned, and if you think back of pre-COVID, what did those offices used to look like? You would go and sit in a waiting room and perhaps have 10, 15 people in that waiting room with you. There would be no one wearing masks. There would be no partitions up. And boy, have things changed in 100 days. So now when you go into your doctor's office and you go into the cancer center, you can expect some differences. The initial difference you're probably going to see is you're going to be greeted at the door. And you're going to be greeted at the door with someone with a mask, which is unfortunate that these days that we can't give that reassuring smile, that face of confidence as you're coming in for this care. It's sad, but it's reality right now, and let's live with it, let's tolerate it, and let's move on. But when you walk in, they're going to ask you some questions to make sure that you are not sick. So they'll ask you about the symptoms of COVID, which have increased dramatically as we have gone through 100 days. No longer will we just ask, are you short of breath and do you have a cough and do you have a fever? We might ask about muscle aches. We may ask about the loss of taste or smell. We're going to ask about abdominal pain. The symptoms that have shown up in COVID now have increased dramatically over these last 100 days. We ask these questions not to be intrusive, but to really to make sure that we are going to treat you safe and make sure that we're going to identify any opportunities we have to treat you differently. And when I say differently, I have to say appropriately, but differently. Now, many of you may be looking at me saying, well, here you are trying to tell us to wear a mask, and yet you are not. And I can tell you that the individuals that are here with me today are greater than 10 feet away from me, are sharing the questions so we can answer your questions, but we have taken every safety precaution, and I just felt that being the distance, I'm hoping that a reassuring smile that I'm giving you or a vote of confidence that I'm giving you can be seen in my entire face and not just my eyes. So let's go back to as we enter the cancer center. So you have an individual who will be there. That individual will ask you a series of questions, and based on the answers of those questions, we'll make determinations as far as what we will do next. Hopefully you're asymptomatic when you're coming in. Now, at this time of the year, we know there's allergies out there. We know people have congestion. We know people have coughing from allergies. But we will take the additional time to make sure we're clarifying that those are not infectious illness symptoms and that they are actually due to something else. You'll be asked to wear a mask. Whether you bring a mask with you that you may find comfortable at home, go right ahead and do that. If you don't have a mask, don't feel that you can't come to the office until you have one. In the Cancer Center, we'll provide you with a mask. We'll show you how to wear it, and we'll tell you the explanations of why we're wearing it as far as how long we expect you to wear it and when we expect you to wear it. You'll go up to the waiting room, and you'll see that the waiting rooms are totally different. No longer are the chairs next to each other. And a matter of fact, we're really going to hope that you're not in the waiting room at all. We hopefully are going to be able to take you straight back to an exam room so that there's really no opportunity for exposure. As you go to check in, you'll unfortunately see a partition. It's a plexiglass partition, but again, we're doing that for your safety. We'll still allow you to see the individual who you're speaking with, but unfortunately, we're going to put those things up right now for a while to protect you, to decrease anxiety as far as why isn't there a partition here, and to make sure that we're going to treat everyone as safely as we can. We'll bring you back to the room, and on the way back to the room, you will probably notice that there's hand gel almost everywhere. Two types of ways to wash your hands through COVID. One is with hand gel, and obviously others with soap and water. You'll find that we're going to find that hand gel is much easier for us to use and works quite well. Hand gel is made up of at least 80% alcohol. The alcohol denatures the proteins in the virus and actually kills the virus almost on contact. So the alcohol also is allowed to dry on the hands so that you don't need to use additional towels. So again, we're doing that for your safety, and we're going to make sure that those are all where you need them and close by for the providers. You'll notice that all the providers are going to be using that. It's unfortunate that we can't shake hands as a way of acknowledgement and introduction, so understand that the doctor's not being rude. He's following what we have. And it's also unfortunate that we can't give you that hug at the end of the appointment saying, you know, we're there with you and we're fighting with you and we're doing everything we can. But remember, the physician is still feeling that as you exit and as he says, we'll see you next time while we're taking care of this illness. If we switch to the hospital, let me go back to the office too for one other thing. The unfortunate thing we have is a no visitor policy now, and you see that across the country. And we're doing that for the safety of the loved one that may have come with you, as well as the safety of the staff. We have to realize that a vast majority of these people with this illness are asymptomatic. So until we get to a point where we can test quickly and accurately on everyone, you will end up seeing visitor restrictions. The unfortunate thing about visitor restrictions is it's that second set of ears, it's that second set of eyes, and it's that second listening to what the doctor has to say and getting the message across. Now, many of you wives out there may be saying, boy, I'm in trouble because my husband has really selective hearing, and he's only going to listen to what he wants to hear. For those people, we strongly recommend that you bring a cell phone with you, and that when the doctor is ready to give the instructions and give the recommendations, that you call. Make sure your husband calls you so that discussion can be heard by both sides. So that second set of ears will still be there, but unfortunately, that second set of eyes will not. But we'll also allow anyone in the family there who's present to ask questions, because the doctor wants to make sure that you leave with all the education that you need and all your questions answered. Nothing more frustrating to us from a doctor when we walk out of a room and we're not sure we answered all the questions. We're not sure we got them all. So you'll see the doctor will take additional time to say, do you have any other questions? And we're wearing masks, and sometimes you can't see that question in the eyes, in the mouth, in the face. So we're going to kind of push those a little bit and say, please let us know if you have any additional questions so that we do as well as we can in communicating. Going into the hospital, whether you go there for infusions or whether you're going to be admitted, you're going to find a very similar aspect. We treat everyone the exact same way. So everyone will be screened as they come in with the same questions. A temperature screening will be done, and we will make sure that we treat you as safely as possible. You'll notice that everyone is wearing masks. It's called universal masking. Anyone in the hospital is wearing a mask at all times. You'll also see if you are immunocompromised and happen to have COVID, you will see that the caregivers that come into your room are dressed a lot differently. They have full PPE on, PPE, protective equipment, so that they will have a mask on, unfortunately, a face shield. You won't actually even be able to see them. But I assure you that they're looking at you with the eyes of empathy and the voice of compassion when they're taking care of you there. I forgot to mention one other thing as we go back to coming to the cancer center. You'll note that the day before your visit to the cancer center, you'll get a phone call. And that phone call will go over any questions or concerns that you may have, and also they'll ask you about symptoms that you may have. And because of that, we're going to do screening the day before so that we don't get you all the way to the cancer center and then have to turn you away because of a symptom. Symptoms may come up overnight, and we will address them if they do come in. So I know many of you have questions, and I think unless I have any other thing that I have missed in my presentation as I'm looking at my four friends to tell me, I'd be more than happy to answer any of your questions. I know one of them is about a visitor policy, and if you have an individual that you're supporting that has cognitive issues, and yes, we do make those visitor accommodations if the individual has cognitive issues or has ambulatory issues. And those of you who are caring for any pediatric patients, we also make that obviously for anyone under the age of 18, that a parent can come with them to the visit. So we want to make sure that we're safe when we're there. We don't want rooms full of family individuals. We're going to make sure that we get the right number of people in and that we can safely care for you. So I will turn to questions, and I know I have some written here that were given to me, and if either that or you guys can read them to me, whichever you'd like.
So Dr. Most, the one question that came in this morning was regarding having a companion during a cold cap treatment for chemo. And so if you could just address, why is that, and when is the possibility of having a visitor accompany a patient for an appointment?
Sure. So the question was more about when could someone come in for a cold cap treatment? Could they bring a visitor with them? Could they bring a family member? We're going to still continue to restrict those. And again, we do that out of protection for both you and the individual. Now, as I say that, I can tell you that Northwestern Medicine today is looking at their visitor policy and trying to figure out how they can expand that visitor policy. So in this world of COVID right now, what I say at 10:45 may be different at 11 o'clock. So please, during that call that you're going to get prior to your visit, ask if the visitor policy has changed. We know the importance of visitors. We know the importance of them from a physical, emotional, social reason, and we want to get back to that as soon as we can, but we want to make sure that we keep everyone as safe as we can. So I know it's frustrating, but at this point, we're going to ask that you minimize the visitors unless you have a cognitive or physical reason that you need that visitor with you.
What happens if I get screened for fever at the Northwestern Medicine Cancer Center?
Yeah, so the question is, what happens when I come in and you screen me and I actually do have a fever? What will you do next? We'll actually take you to the side and move you to the side, and we will discuss that with you, and then we'll discuss it with your physician who you're coming to see. So you may be coming to see Dr. George, and he says, I know she has a fever. That's one of the reasons I'm seeing her today. Please escort her up. Others may say, boy, this is a routine visit. There's really not a lot we're going to do. I'd rather sort this out. Ask the individual to reschedule the appointment, and then the doctor will follow up with you to discuss what could be going on with that fever. There's many reasons for fever. COVID is a very small portion of them. Regular influenza can give us fever. Strep throat can give us fever. Pneumonia, a lot of infections can give us fever. So don't assume that you have COVID just because you might have screened with a fever. We will definitely check to get to the basis of why you have that fever, and we might do it in the primary care office instead of in the cancer center where we have way too many vulnerable people that may be exposed to something that you may have that's infectious.
What should I do if I test positive for COVID?
The question is, what should I do if I test positive for COVID? If you understand the COVID and the illness, about 50%, maybe even more, of the individuals who test positive are asymptomatic, meaning they don't have fever, they don't have cough. And if I said, hey, you're positive for COVID, you would laugh and say, no, I'm not. I don't have any of those symptoms. Well, unfortunately, that's the reason that we're all wearing masks right now as well. So if you test positive for COVID, three things we really want you to do. Number one, you go into a self-quarantine. And when I say a self-quarantine, I don't mean a shelter at home. I mean a self-quarantine. You unfortunately pick the room in the house that you want to control, and then you tell everyone else that they can't come in. So please make sure there's a TV, there's a computer. It's about you at this time, because you're going to be quarantined for 14 days. Now, we will allow some exposure, but we have to make sure that any exposure in the family is documented as well, because we're going to want to quarantine those individuals for 14 days as well. The reason we do this is we know that the illness will last approximately 10 days. And if we figure you had it for 2 or 3 days before, we hit the day of the quarantine of 14 days. Now, people say, well, wait a second, I've heard that you still test positive after 14 days. And that is true. Matter of fact, some individuals will test positive up to 40 days later. That being said, we don't think that there's an infectious illness portion of it that you can be contagious after those 14 days unless you're having symptoms. So the asymptomatic person, that's going to be what we're going to do. The other 2 things we're going to ask you to do is, one is contact your primary care doctor and let him know that you tested positive. We also want you to contact your oncologist to make sure that they are aware that you tested positive, as you may be up for chemotherapy, or you may be in a point after chemotherapy where your immune system is compromised as much as it can be, and we're going to watch you as quickly and as closely as possible. The other thing you may see or you may hear is something called contact tracing. We're starting to get more into contact tracing, and fortunately the governor will start to increase this. And what that is you just tested positive and you didn't know you had it. Well, for the past 2 to 3 to 5 days, you may have been visiting people, you may have been somewhere, you may have been to an office. We want to know if that's true. And if it is, we want to make sure that we identify those individuals who you may have been in contact with and get them tested as well. The way we control this illness is to decrease the number of asymptomatic carriers out in the public. So we're not quarantining you to be mean. We're quarantining you to make sure that you are not going to spread this illness to others that you know and love. So that's why, and that's what we're doing.
If I'm a cancer patient undergoing treatment and test positive for COVID, is that going to delay the course of my treatments?
So the question is, you're undergoing chemotherapy or treatment and you tested positive. That's a decision that the oncologist is going to make. Depending on your treatment, it may not impact your immune system as much as it does the tumor or whatever else they're treating. Some chemotherapy and some treatment is definitely going to decrease your immune system. And for those, the oncologist is definitely going to want to stop and take a moment to say, is this a good time for chemotherapy? But again, please discuss it with your oncologist. I'm a family doctor. I can tell you the oncologists we have at Northwestern are a whole heck of a lot smarter than I am, and they know a whole heck of a lot more of what to do under those conditions. But know that there are some conditions where the doctor may say, yes, we will continue with your therapy. And there's others where they're going to say, we're going to postpone it. We're going to postpone it as short time as we can, that will still make sure we impact the illness that you have, but do it in a safe manner to protect you.
Do I need to wear gloves to my appointment? And why or why not?
Yeah. This is a question I've been asked numerous times, is the importance of gloves. And should I wear gloves to my appointment? And I'll expand it to, should I wear gloves to the grocery store? Should I wear gloves wherever? 2 big things here. One is the disease does not go through our skin. So the disease is not, if it's on my hands, it's not going to enter my body. The only way it's going to enter my body is if I touch my nose or I touch my face and I do things. I've just taken the virus from whatever it was to my nose and face. I don't know about you, but the times that I have to wear gloves, I don't wash my hands because I have gloves on. So washing your hands is probably much more important than the gloves, because if you have the gloves on, the virus can live on gloves, on the rubber, on the plastic for 3, 4, 5 days. So how are you going to discard those? How are you going to take those off? It's much more important that you actually wash your hands frequently. Going to the doctor's office, you'll have that opportunity. Now, going to the grocery store, if you want to be overly cautious because someone might have picked up that bottle of ketchup just prior to you, then go ahead and please wear gloves if you'd like. It will protect you from the shopping cart. And I can tell you that if you've seen what's recently come out from the CDC, our biggest concern is not the surfaces and not the containers and not the door handles, but actually transmission between each other. So the 6 foot, 8 foot, 10 foot distancing in wearing masks is much more important than the gloves you're wearing. So please don't go to the store with your mask down below your nose, but you have gloves on thinking that you're in much better shape.
Can I use the elevator at my appointment?
The question is, can I use the elevator at my appointment? Absolutely. We know the importance of elevators in many people, especially some of your doctor's offices may be on the 3rd or 4th floor. Now, I don't know about you, but if I ran up 4 flights of stairs because I was late for my doctor's appointment, I'd probably be doing more harm to myself than good. So really, let's make sure that we use the elevators properly. You will see some interesting things now with elevators. I'm sure if any of you went to the top of the Sears Tower, you were jammed into an elevator with 30 people and trying to make fun of people while you were looking at them and laughing and kidding with your friends or your kids. Those days are over. Our concern now is how much time will we be together in an enclosed environment. So now you're going to start to see that elevators are fine, but we're going to limit the number of individuals in the elevator based on the size of the elevator. So you'll see that most of the elevators in medical offices and in the hospital, we're going to limit those to 2 individuals. We also would recommend, especially people who have some anxiety, to bring a pencil or a pen or a tissue to push the button that you want to use going to the floor that you're headed to. So if the elevator has 2 people in it, then wait for the next one. Now you may say, wait a second, the last elevator had 5 people in it. It may be that that's all a family or family members going to a visit, but really look out for the safety of yourself. And remember that wearing a mask, we're trying to protect those around us in case we're asymptomatic carriers. So we want to be polite as well as cautious when we get in elevators with others.
Is there a chance I will be exposed to coronavirus when I come into the cancer centers?
I wish I could say no. I wish I could say that the Cancer Center has aerosolized hydrogen peroxide, UV light, and every Lysol wipe in the world that we could have that's just there all the time. But unfortunately, in the world we're living in right now, the possibility of COVID being in a place is very possible. Now, can you get it? Not if we follow everything that we just talked about. If you're wearing a mask and everyone's wearing a mask, if you're washing your hands and not touching your face, if you're social distancing and physically distancing from individuals, if you follow all of those, the chance of you getting COVID is extremely low, probably close to 0. You have a higher chance of getting COVID going to the gas station, the grocery store, or picking up food at a carryout than you do at the cancer center or any of the hospital settings. We are overcautious and overabundant as far as how we're going to protect you because we know that people that are coming there are the vulnerable population that we're concerned about that has the greatest impact with this disease.
A question came in. Victoria is asking, when do you think the volunteer services will be back and running at CDH?
Victoria, it was Victoria,
Yes.
right? So Victoria wants to know about the volunteer services at CDH. You know, I talked about the volunteers and the support staff here at Living Well and how much they miss all of you that come here for over the, 150 different series that they have here. I can tell you that we at the hospital miss you as well. We miss your smiling faces. We miss when you bring us the newspaper. We miss you in the hall delivering flowers. You provide such an unbelievable service to us, and we really, really do miss you. And I smile because I know many of the volunteers, and I goof around with them all the time, and I can tell you that we do miss you. When will you be back? I'm afraid it's going to be a little while. Unfortunately, if you look at the volunteers, you fall into the vulnerable population, guys. Most of you are well over the age of 65, and we appreciate everything you do, but we're going to protect you, and we're going to make sure that you don't get COVID because of something that we did. So we're going to make sure that we protect you. And you said, well, wait, Dr. Most, you just said a minute ago how safe it is. It is. It's extremely safe. We're being overly cautious, but we're also going to be careful with you. And I know it's difficult because I know a lot of you, that's a social part of your life as well. You interact with the other volunteers. Please, I hope you're calling them. I hope you're Skyping, Facebooking, doing something with them because they miss you as much as you miss them. We will get you back to CDH, and this is for all volunteers at Del Nor as well, and the volunteers here. We will get you back as soon as we can safely.
How does Northwestern Medicine make its policy decisions on patient safety and COVID?
Yeah. So the question is, how do we make our policy decisions on patient safety and COVID? If you look at a hospital and the complexity of what goes on at a hospital, every single patient comes in, they're different. They have a different history, they get different medications, they have different illnesses. So safety is probably, I'm not going to say number one on our list. It's number one, it's number two, and it's number three. We are so concerned about safety, the safety of individuals when pre-COVID. So now that we do have COVID, you can imagine how safe we are. So we take our recommendations from not only the CDC, the World Health Organization, the Illinois Department of Public Health, but we also look at other organizations and other large institutions. I meet with the CMOs and talk with the CMOs of Advocate, of Edward Elmhurst. We're all good friends. We compete, but we're all good friends, and we share everything we do. And any new safety tool that we came up with, or any new thing that they noticed or we noticed, we share those on a regular basis. We also have committees that are going to look and say, okay, what can we do for the visitor policy? What are we going to do about universal masking? What are we going to do about N95 masking? So we have committees that look at that stay up to date. And when you look at what's happened over 100 days of COVID, has that changed? Dramatically. 100 days ago, we weren't doing universal masking. 80 days ago, we had our first patient at CDH. We weren't doing universal masking at that time. And now look at what we're doing and how we're treating this illness as we've seen and learned over the past 100 days of the impact of it.
Last question. Where can I find the latest information about patient safety from Northwestern Medicine?
Yeah. So where can I find the latest information of patient safety at Northwestern Medicine? If you go to nm.org, there's a bunch of COVID information, but it is the patient safety is there. It'll go over just about everything that I just went over earlier about what we're doing to keep you safe. It's also a great resource for COVID. I laugh and say we should have looked at that when we first started this 100 days ago and look at it now, because the information has changed so dramatically. So we ask that you use it as a resource, and if you have questions or concerns, there's resources. We have COVID hotlines, as well as your doctor's office and your doctor's staff can answer questions if you have that aren't addressed there. And also take any opportunity you can to post questions here, and I am sure that the Living Well folks will get those questions to me, and I'd be more than happy to answer any ones that we didn't get a chance to answer today, unless we still have more time. It's up to you guys.
I think we've answered all the questions
Great.
that came in.
Well, I can tell you, on behalf of Northwestern Medicine, myself, the folks here at Living Well, we hope that you're doing everything you can to stay safe, do everything properly. Know that we are out there looking out for you to keep you as safe as we can when you go to your doctor's office, when you go to those visits, when you get those infusions. Please don't delay them because of the fear of COVID. Know that we're taking care of you and we're looking out for you. So we're there for you, and hopefully we'll see you soon without a mask, when we can give you a handshake and a big hug. And until then, really, stay safe, you guys, and please watch out for each other.